Over the next several years, every employer in the U.S. will be making a decision about staying in or getting out of healthcare. Do I stay in, provide health-related and insurance benefits to my employees? Do I get out, send my employees to the exchanges, and pay the fines? In order to answer this question, each employer must determine the full dimensions of health, not just the cost of health care, but the cost of pharmaceutical benefits, absence from work, disability, and health-related performance at work from their employees. Only then will employers be able to understand the full value of a healthy workforce and the full impact of interventions around health. Traditionally, employers have believed that the big ticket item is healthcare expenditures. Since probably 5 or 8 years ago, they've added pharmacy costs into that bucket. But more employers recognize now that additional costs, absence from work, disability, performance-related issues around health, are real costs that hit their bottom line, and they're looking for new solutions to manage those costs. Before we started IBI in 1995, I spent 11 years directing a workers' compensation research program. Now, what's interesting about workers' comp is a truly integrated system, medical benefits and disability benefits and return to work. When we broadened that view to other benefit programs, we realized that we needed to integrate outcomes data like absence and disability to the more traditional healthcare cost data and pharmacy cost data to give employers a full picture of what costs related to health actually are for their business. Employers from our surveys recognize that health is more than healthcare costs. The challenge that employers have today is, where do I get the data? Now, what we've done at IBI to help employers is developed a series of modeling tools so that employers who are data challenged can actually start to quantify what these additional costs are and start making decisions not only about the full value of health, but perhaps even more importantly, what data they need to collect in order to make that calculation. Whirlpool Corporation won the IBI NBCH Health and Productivity Award at our last conference. We've been working with Whirlpool for several years on a variety of measurement projects and integration projects, and I think Whirlpool is a great example of a sizable employer that really is taking seriously what the full costs of health are and better determining what the value of investments are leading to for their business as well as their employees. Healthcare reform has led to a variety of new conversations about healthcare. It's very important that employers truly understand the value of a healthy workforce and be able to measure the impact of health interventions. It's been a big challenge for employers, but they clearly understand that this is much more than healthcare costs. And if they're going to stay in, they need to demonstrate why it matters to their business and their business results.